Ta-da! Good morning. It's wonderful to be here. Welcome to the Public Health Network Cymru's Healthy Minds for Future Generations promoting dementia risk reduction event. I'm really excited by this event because actually we don't often talk about risk reduction because I think at the moment we're stuck in a fear place, because a recent survey with people in their 50s and 60s showed the biggest fear that people had was that they were going to be diagnosed with dementia. Well, actually, I think what today's agenda shows is that there are things that we can do to make a difference.
I'm going to focus on lifestyle. That is the aspect of disease prevention, the aspect of disease risk that is under the subject's control. And I think there's a responsibility on the population of Wales and beyond to pay attention to their lifestyle in relation to the reduction of disease. They're all looking for a pill for every ill. There's a lot of work to be done and a lot of benefit to come from attention to lifestyle.
When you plan your services, when you want to deliver your services, see if it's the services that we want. We are the experts. We are living with dementia. I am living with dementia. So I want to play a key role, and I think we can, when it comes to delivering and planning services, particularly at the planning stage. If you want it to be real, if you want it to mean something, then you must engage with the people who you're targeting for your services. To write these things in baroque and splendid isolation, you will just doom it to failure. Once we're engaged, we are much better when you do things with us rather than to us.
A lot of the discussion that we've had today is around, and particularly from the gentleman with dementia who spoke earlier, that dementia, a diagnosis of dementia doesn't have to be life-ending, although it is a terminal condition, but it is life-changing. And I think what professionals, health and social care professionals and those in all agencies, when you're talking about dementia, is that it is exactly that, life-changing, but you can still live your life well with dementia, dispelling some of the myths around dementia, that you can't learn new things, that you can't participate, that you are not able to live your life effectively and meaningfully. We need to dispel that myth. It can be done.
I think there's always further evidence we can gather around the science of impacting on dementia risk reduction. But for me, the real evidence gap that we lack, and the area where I think we should be putting more effort in, is how do we translate the knowledge we have in public health and in the NHS and in wider society into realising the behaviour changes that we need to make a difference. How do we enable people to change their lifestyle? We know lifestyle impacts on our health, we know lifestyle impacts on the potential to reduce dementia, but how do we enable people, help them to make those changes, and do we have enough evidence around those things which are effective in assisting people to make lifestyle changes?